presentation and shorten it quite a bit. So there may be some things that I fly through pretty quickly, but you will receive the PowerPoint presentation with my notes in it that you can review at a later date. So I apologize now for the speed of the presentation. Okay, so a quick outline of what I'd like to talk about today. Start with a general overview very, very quickly about statistics of suicide in the US and specifically in West Virginia. Talk a little bit about the history of suicidality in pandemics that we've previously had. Look at some of our really early understanding of the psychological impact of COVID-19, how it has impacted suicidality, and some risk and protective factors as well. Quickly, just note that these are 2018 data, and this was the newest that we had, but suicide is the 10th ranking cause of death in the US and the second leading cause of death for adolescents and young adults. In West Virginia specifically, it is also the 10th leading cause of death in West Virginia and the second leading cause of death in that same age group. We're also ranked 8th in the country in suicide rates, and that's 8th in a bad way, so the 8th most suicide rates per the population. Which is why I think it's really important that we have this discussion about how COVID could possibly affect the people of West Virginia. And there's some slides at the end that look at rural communities and suicidality. And we know from the research that there is an increased rate of suicide in rural populations. So quick caveats before we begin. As I'm sure many of you are aware of, COVID has allowed research to process very quickly throughout the pandemic. And so luckily we're seeing a lot of studies very fast. However, that also means that studies become outdated very quickly. So you'll see throughout the presentation, some of my citations have dates next to them. That's trying to help you give a context to when this study was published, and in understanding that if a study was published in June, it may be very different from a study that was published in October. Also know that as quickly as things are published, they become outdated research, and there may be things that have changed even since I've put together this presentation. So if you have other information or have recently read things about suicide and COVID, I'd love to hear them. Let's look very quickly back at the history of other pandemics and what we do know about what happened with suicidality. This is important because researchers are suggesting it may take us 18 months to 2 years to fully understand what happened and suicide rates within the pandemic. And so if we can look back to what happened to other ones, maybe we can try to mitigate some of those risk factors. The Spanish flu, COVID's been compared to that pandemic frequently, although there were a lot more people infected, a lot more deaths, but they did see increased rates in suicide, and they have hypothesized that that was because of decreases in social integration and interactions and fears of the pandemic. Again, all things that people are concerned about today. And then the other historical reference is the SARS outbreak of 2003, although these are not specific to the US. But there were increased rates of suicide found after the SARS pandemic, and they believe that that came from fears of contracting the illness, fears of the burden on family, general anxiety, social isolation, and psychological distress. Well, I'm going to speak briefly about a study in China. Most of the rest of the presentation focuses on protective and risk factors for individuals in the US when it comes to COVID-19. What we know, again, early, so this is a June 30th, 2020 citation. So this was studying people in March of 2020, very early into the pandemic. And they found that in China that there were increases in anxiety, depression, harmful alcohol use, and decreases in mental well-being. Interestingly, they found that this mental distress was highest among young people, ages 21 to 40. And they found also that frontline healthcare professionals had the highest risk of anxiety, depression, insomnia, and distress. In the US, in just the week ending in March 21st, 2020, compared to last year, so 2019, alcohol sales had risen by 55%, and online alcohol sales had jumped by 243%. Researchers have speculated that this likely could increase problematic alcohol use for individuals in the US, which could have longer term impacts and increase the risk of suicide. We also know that there were increases in calls to suicide prevention hotlines very early into the pandemic. Briefly, let's talk about some factors that have impacted the pandemic on healthcare professionals. There was a study published in July of 2020 that looked at prevalence rates of anxiety and depression, and found that the higher prevalence rates in anxiety and depressive symptoms in healthcare professionals were linked to these 6 areas on this slide. I won't go through all of them, but just as a broad overview, it was linked to the how close a person was to COVID exposure, so first line care, emergency room, intensive care units, COVID-19 hospitals. Having COVID, becoming positive with COVID, having peers that infected, vicarious traumas, hospitalizations. And then epidemiology, they looked at a greater distress when cases are increasing in your area. So this wasn't all healthcare providers had an increased risk of anxiety and depression, but it was based on where the cases were rising. They looked at healthcare policies, public data transparency. There were issues, particularly in the beginning of the pandemic, of material and PPE availability that really increased anxiety and depressive symptoms in healthcare professionals. Healthcare professionals who were moved to they were converted professionals. So if it was a professional that worked in outpatient surgery is now working in the ER or on a COVID unit, those individuals struggled more with anxiety and depression. The other issue was the higher level of the professional responsibility of the healthcare professional increased the likelihood of anxiety and depression. So the attending in charge of the emergency room, having more professional responsibility of that situation is actually at even more increased risk. And then they looked at personal factors, children, coping strategies, social support, age, gender, as well as some premorbid mental health concerns. So let's look at risk. Oh, I got a note that my PowerPoint has stopped working. So let's see what's going to happen here.
Dr. Lillard, I can pull it up on my end as well if you'd like.
Yeah, let's have you pull it up because it looks like my PowerPoint's restarting. Perfect. Yep, risk and protective factors, great. So I apologize if I'm looking off the screen now. I'm looking to the notes that are over on my other screen here today. But I wanted to talk a little bit about some risk and protective factors to suicide specific to the COVID-19 pandemic. And we're going to look at this in different levels. So starting at kind of a society level, and then a community level, and then a relationship level, and then lastly, an individual level. Psychology, we often really focus on those individual risk factors for prevention or intervention with suicide risk. But I think it's also, particularly in light of the pandemic, important for us to consider some of these societal and bigger picture issues and struggles that are happening. You can go to the next slide. Thank you. So at a societal level, let's look first on the left-hand side to some of the important risk factors to consider. And the first was economic downturn. And so there was a study published in June of 2020, actually had nothing to do with the COVID pandemic. It was a study that was already in the process of being released, but it's important. It was done by Eric L. Bogan out of Duke University, and he used a data sample representative of the US population. They had a total sample size of 34,000 individuals. And they used the National Epidemiologic Survey of Alcohol and Related Conditions, and they looked at the relationship between financial strain and suicide attempts. And they defined financial strain as financial debt or crisis, unemployment, past homelessness, and lower income. And they found that there was a cumulative effect. So the more of these 4 factors that somebody had, they were 20 times higher probability of a suicide attempt. And so that was striking. And then what researchers have done since then is they've commented on how they think the COVID pandemic is going to exacerbate those issues. And so we saw a economic downturn. We saw increased huge unemployment rates when COVID began. And so they're using that to predict that there are higher suicide rates, that there will be higher suicide rates due to the COVID-19 pandemic. And they also said they looked at, because they had looked at that unemployment and then homelessness, and they really were struck by the point that suicide risk is elevated just prior to evictions. And so it, you know, homelessness was a risk factor for suicide, but it's even that time period just before that that is very concerning. And the big concern there is that there was a stop on all evictions until I believe July of 2020. And then landlords were then able to start the eviction process again for individuals, which could increase suicide risks. They also looked at barriers to healthcare being a risk factor for suicide in the COVID pandemic, access to means, meaning access to things that could potentially be lethal. So access to firearms, access to medications that could be deadly. And then inappropriate media reporting. This looked at kind of media reports that were scaring individuals and kind of doomsday reports about the pandemic. And on my PowerPoint at the end, there's additional slides that show tables where they broke down some of these different risk factors and protective factors. It's important that when we're talking about risk factors for suicide, we're also talking about the other side, the protective factors, the ways that we can intervene to mitigate some of this risk. And at a societal level, Wasserman and his colleagues talked about protective factors, including effective mental health care. In psychiatry and behavior medicine here at WVU, we did a rapid shift to complete telemedicine for psychological and psychiatric services. It was pretty incredible to see how quickly that infrastructure was able to be changed. There was some legislation that came through that allowed a reimbursement of those services, which helped really, hopefully for the people who are already established with mental health care, protective factor to keep them engaged in treatment. Other protective factors, they looked at legislation, which I thought was really interesting. They looked at ways legislation can increase healthcare accessibility, prevention, how legislation can look at economic and social inequalities. These are things such as the CARES Act that gave, you know, stimulus checks for individuals, extra money for the unemployment. All of those were protective factors, kind of in contrast to that economic downturn. And so we have this economic downturn that we know increases suicide risk. How do we mitigate it? We mitigate it by helping individuals economically. Next slide, please. Let's look at some risk factors then at the community level. So again, we're getting smaller as we go down. Within the community level, concerns for risk of suicide included discrimination. Unfortunately, we have seen disproportionate amounts of minority individuals contracting COVID and some healthcare disparities in the care that they get, whether being sent home and those issues. There's also stresses on people's acculturation and maybe dislocation. People may have to move, college students going back home with parents. Protective factors though at the community level, although we talked about the Spanish flu pandemic and the increased risk in suicide, it was suggested that some of it was from social disengagement, social isolation. it was protective. The protective factors are if people can find ways to integrate socially. If these, I'm thinking of the Zoom parties that people had, the different television specials that came about to help people feel like they were connected. People being able to go outside and sitting 6 feet apart and having some sort of picnic with family and friends. They talked about other protective factors being local prevention and then rehabilitation programs. Next slide, please. At a relationship level, risk and protective factors for suicide, particularly in the COVID pandemic, as mentioned in the Spanish flu and in the SARS outbreak, were loneliness. There was a big concern that loneliness was going to increase individuals' risks. There has been a large concern about relationship conflicts, relationship discord, and loss, and more particularly domestic violence. Individuals being quarantined in a home together, they worried about those increases, and I found a quick news story before this presentation that recently, I think there's some data to support that there was increases in domestic violence during the lockdown period. The other issue that mental health providers have been very concerned about is children and child abuse within the homes, and concerns that it would go unreported because many abuse situations are reported by schools and the individuals were not at school, and therefore it was not coming to the attention of teachers. But then protective factors at a relationship level, they talk about having really strong personal relationships can mitigate some of that risk. Next slide. Lastly, and the area that psychology focuses on the most is risk and protective factors at a personal level. Risk factors include predisposition or a previous mental illness. They looked at, and so kind of going off of the Spanish flu pandemic, they talked about some of this being uncertainty. The uncertainty of how long this is going to last, the uncertainty of whether or not you're going to get sick, the uncertainty of how an individual contracts the virus, that tends to really increase people's worries and fears. And what they found is that when the increased worries and fears and the anxiety increases, it affects sleep. And disturbed sleep is a huge risk factor for suicidal ideation and suicide attempts. And they actually said that uncertainty for people is worse than knowing that something really bad is going to happen. That uncertainty, that anxiety seems to affect us more than just knowing that a bad event could happen. So in the UK, they have this daily economic policy uncertainty index. So it's some kind of index that they update daily that talks about how uncertain is the economic climate in the UK. And they have analyzed it over a period of years and found that the spikes in uncertainty in this economic index, when those spiked, immediately following were spikes in suicide rates. It wasn't even delayed. When the uncertainty increased, rates of suicide increased as well. Perceived job instability, unemployment, those go into that financial problems. On the personal level, we looked at it from more of this like societal level, but also from just an individual level. Job instability and unemployment increase risks for depression. And we have, we can look back and see that in the housing bubble crisis of 2008, between 2008 and 2010, more than 100,000 suicides, more than they had expected, occurred in the US, Canada, and the UK. So 100,000 more suicides than expected occurred between 2008 and 2010 with the economic uncertainty of the housing crisis. We looked at that social isolation factor with loneliness and relationships. I think social isolation can come into some of the hopelessness risk factors at a personal level. And they say that it's both a subjective and an objective feeling of loneliness. So an objective feeling of loneliness is physically living by yourself and being quarantined or isolated. Subjective feeling of loneliness, though, is the perception that a person is alone, even if physically they are not alone. And both of those were risk factors for suicide. When this chronic pain one is interesting, we know that chronic pain in general increases an individual's risk of suicide. But it's important to keep in mind with COVID-19, we're thinking about the long haulers and the people who are having effects of their COVID illness extending over time. And they said that people who have had severe COVID symptoms are at risk for depression, anxiety, and PTSD. They also have long-term pain associated with their previous infection, and that's going to increase their risk of suicide. So particularly, we need to be aware of how these kind of long haulers are doing psychologically. And based on the studies that they know now, and they put them into prediction models, they estimate that between 2,000 and 9,000 more suicides will occur due to the pandemic worldwide. So they are expecting there to be an increase in suicides worldwide. This was in May. I'm not sure if that has shifted with the continued pandemic as it sits today. As we talk about risk factors, we also talk about protective factors. So these are kind of the coping skills or the tidbits of self-care that we can give our patients, and that's, you know, giving them some positive coping strategies, finding ways for them to cope that include maybe staying at home. This is where we saw puzzles being sold out on Amazon everywhere, maybe some different yarn craft activities, could be exercise. They also talk about religion and spiritual beliefs being really important, food and diet, eating healthy, physical activity, and sleep. Next slide, please. That kind of blends into this next slide, which looks at how do we prevent suicide during COVID? And there's kind of two different areas. The first being the general population. We can prevent suicide by helping to find ways to decrease their levels of stress and anxiety, fears, and loneliness. We can help people figure out how to stay connected, maintain relationships, get enough sleep, healthy food and exercise, and to check in with the elderly and people living alone. There's also some suicide prevention tips for high-risk groups. These are individuals with a previous psychiatric illness. These are COVID survivors, elderly, and frontline healthcare professionals. They are our high-risk group. And we can, the first is that we want them to maintain their treatment. If they have a history of psychiatric illness, we want them back in seeing their providers as regularly as they can. And that means that we need to increase telemedicine, which I think WVU definitely has done a huge changeover with telemedicine. And possibly maybe for some providers, increasing contact with their patients. Next slide, please. So my last slide for us today, because I know I've gone over time, is to just talk briefly about rural communities and suicide. We know that there are higher rates of suicide in rural communities. They believe this is because of low social capital, high social fragmentation, less health insurance, and actually we have an increased population of veterans. There's an interesting study that came out of Kentucky, and they looked at suicide rates just between March 13th and the 27th, so 2-week time span, right when the shutdown started. And they actually found 50% lower suicide rates compared to their data from the previous 7 years during that 2-week time period. And they described this as likely a honeymoon phase. The honeymoon phases have very high community cohesion. At the beginning of a crisis, we're all going to come together. I was thinking of my kids watching those Disney specials where everybody was singing songs and coming together at the beginning of the pandemic. Unfortunately, what healthcare providers need to be aware of now is that the next phase becomes the disillusionment phase. This is where resources are limited, the crisis stops being acute and becomes chronic. People are discouraged, they're stressed out, they're exhausted. And this is where substance misuse may really start to emerge. Recent stat I heard is that there's been a 40% increase in opioid-related deaths since the pandemic began. And this disillusionment phase is likely what's occurring now, which researchers would then predict we may see some increased risk of suicide. And after that, I have those additional slides available for you to view. This might be a good time to switch to questions and answers.
Thank you so much, Dr. Willard. It was such a timely didactic, and it was great hearing it again, and for this group as well. Thank you. Dr. Costello, before we jump into any questions, was there anything you wanted to add as well?
No, I thought that was great, and I'm going to just share in the chat that AAP just last week released updated guidance on emotional and behavioral health for pediatric patients in particular. So I'm going to share that link. It has a lot of the stuff that I think we're hit on, but I know sometimes individuals want particular resources for children and adolescents. So I thought I would share that in the chat, and Mitra, you always do a great job of sharing that after the echo as well. So otherwise, thank you. That was great, Dr. Willard. That was really timely. And I think particularly the last part, I think we're seeing that so much. And, you know, obviously it's been a really rough year, and, you know, obviously what's going on right now in society is kind of adding on to that with elections. You know, we're seeing again, you know, disagreement, and it seems, you know, additional ongoing stress in addition to the pandemic. So I do think it's something to be cognizant of. I worry about as we enter into other respiratory season and we move more into periods where we would typically be isolated because of cold weather, you know, even all the more reason to be timely. So thank you so much for that excellent talk.
Thank you, Dr. Costello, and for sure I will include the link and resource in the recap email. So we didn't get any questions in the chat, so if anyone does have any questions or comments even, please feel free to unmute and chime in. Dr. Willard, I know you had a few more slides left too, so if you wanted to refer to those, since we have a little more time left, we could certainly do that as well. Maybe it'll give some folks some time to think of some questions.
You want to pull up those slides again? We can go to the very last one if you'd like. So this might be a nice slide just to see kind of hierarchy of how how suicide may increase. This was another study published pretty early in the pandemic, but we hit on these. It's that uncertainty, the social isolation, and the economic problems, particularly for vulnerable groups, such as individuals with pre-existing psychiatric disorders who are maybe lower in resiliency factors, those that reside in high COVID prevalence areas, and as we know, that's shifting. There's new waves coming out, rates are increasing across the country in different areas. And then people who've had a family member or friend who's died of COVID. And so just having some of those vulnerabilities can increase the risk of suicide alone, but then also they can exacerbate other things. They can exacerbate pre-existing psychiatric disorders. They could cause a depressive episode, lead to an anxiety disorder. Really, that alcohol and substance misuse is really concerning when it comes to suicide. And then possibly other psychiatric conditions as well. Thoughts or comments there?
Thank you, Dr. Willard. Do you know of any sort of resources you could recommend for a primary care type of setting?
I don't.
So I got a question in the chat, wondering if there are any studies that have come out focused on public health staff in particular, and anyone come in as well.
I cannot think of any. Lauren, did you have a specific group of staff you were thinking of with the public health staff, like those Frontlines doing COVID testing, those?
Lauren, you are muted as well.
I think she might. Well, go ahead, Lauren.
Okay, I was just going to type it in, but I can speak on it as well. I was just curious, being an epidemiologist myself, if I mean, of course, it makes sense that the frontline workers are experiencing like a humongous burden of stress and anxiety and depression. But I was also wondering about those who might not be on the front line, but who are still trying to respond to the pandemic. Epidemiologists, those who are testing, local health staff, etc.
Yeah, I have not seen any specific studies. I think it might be a really interesting area of research to investigate, but I imagine, you start looking at burden and like burnout for employees and the number of hours. I can imagine as epidemiologists, you're asked to run these statistics very quickly and keep everything up to date and make sure the testing is done as quickly and accurately as possible. And so all of that, I think, leads to this just kind of overall exhaustion that many people are feeling, which then could then exacerbate different psychiatric symptoms and illness. I don't know if Dr. Costello had any other thoughts.
Yeah, I was just going to chime in. I think Lauren articulated that well, but also local health who have, in addition to all the other, the COVID, they also have other requirements. And many times, local health, I think public health was underfunded, understaffed before we went into the pandemic. And really, people have been working basically nonstop weekends. And so I do think that, and certainly I learned that going from mostly a clinical practice to then kind of going and working with public health. I've been so inspired by all the people that I've met behind the scenes that produce this data, produce recommendations, and they're really working nonstop. And so I do think that would be interesting to look at, because I think obviously there's the stress of those on the front lines within the hospital system, but there's a lot of work that goes on behind the scenes in regards to public health planning and particularly at the local health level. And we've heard that consistently that, we're starting to see public health officials retire, because they're just like, we're done, retire early, maybe when they hadn't been considering it or looking at, taking other jobs or leaving. It's also been challenging to hire people into that field right now because individuals, know that it's going to be a heavy lift. So I do think it would be interesting to look at, the public health officials as well. And I know ASTO, like kind of a national organization for local, state and local health officials, has done a lot on that, just providing mindfulness and different lectures regarding what to do to try to help, continue on in the face of the pandemic and make sure, talking about self-care.
I would also imagine that the feeling of kind of people aren't paying attention to them as much. There's been a lot about healthcare heroes and those frontlines individuals, but sometimes the individuals in the back that are making everything run smoothly get kind of forgotten, which would then, increase that kind of burden. You can only work constantly for so long before it starts to get demoralizing.
Dr. Baltier, I noticed you raised your hand as well.
Yeah, so I had a question, an observation. So I think early in, when everybody's in crisis, especially even the frontline workers, unless you're overly overwhelmed, you're doing your job and you get through it. And I think the longer this goes on, particularly I've been seeing in our patients, they were actually, I do a lot of addiction work, and initially they seem to be coping okay. Now it seems to be devolving. I don't know if you would comment on that, if you kind of seen that. Also, kids may be doing better, but their parents aren't. They're actually having quite a bit of trouble with that. And so if you could just comment on those two things.
Yeah, I think it really speaks to that honeymoon and now the disillusionment phase of the pandemic. We can be very good when the adrenaline is running and the crisis is acute, but I think at some point, many of us, maybe June, July, and there was no end in sight, and still August, September, October, it just kind of, you then have to shift, right? This can't be this like, I'm going to run on adrenaline to make this work. This is like adapting to this quote unquote new normal, or this new environment that we have. And I think that's been really hard on some individuals. And we know that those individuals that are able to adapt, maybe who have jobs that have been easily to adapt to tele versus those who've had to go in person or have been unemployed, really has been kind of extra stressful. I don't know a whole lot about the child side. I don't know if Dr. Costello can speak to that. And I wonder also what it's been like with the new school adjustments and the blended learning and everything.
Yeah, excellent question. That's, I think the links that I shared, one to the press release, and then there was actual link to the guidance. We're certainly seeing this. I can say anecdotally, I've had at least 2 individuals when I was on pediatric wards be admitted for suicide attempts that they noted COVID. One was, you know, just the stress associated with COVID and kind of what you spoke to, like no end in sight. And so, and other people kind of just noted more of the isolation of not being able to, I think, as you articulated, be kind of in the normal. But I think it's really a good point about the parents, because, you know, from parents having to struggle with, do I send my child to school? Do I not send them to school? You know, some don't have a choice, but, you know, then there's all these school closures when there's cases, and we're starting to see, you know, obviously increased cases of that, which we expected to see to an extent, to virtual learning and making that adaptation. And so I do think that we have seen that certainly in regards to parents, and also just the stress of, you know, some people can't take off their job, and you know, we've seen cases of that, or seen cases where children still get sent to school if they're having symptoms because, you know, the parent can't stay at home and you know, care for them. They have to go to work. So it definitely is multifaceted, which I think then ultimately also contributes to stress and the mental health decline in that population as well. So I don't know if there's specific statistics. I think, as Dr. Lillard said, a lot of this data is going to take time. I do know, and can say from a DHHR perspective, from the beginning of the pandemic, this was very much on our radar, in regards to also other mental health, you know, or concerns like domestic violence, child abuse, you know, suicide, homicide, looking at those rates. But I think it's going to take time to really get that true data, as we've said on other things in the pandemic. And I think as we're seeing more and more, the society and the age in which we live, people want instant data and they want instant information. And I think for some of it, we're trying our best, and we have to continue to study it and learn as time goes on. And that's certainly true in pediatrics, as you know, this has been such a roller coaster for them. And I think it also depends upon the age of the child. You know, the very young, you know, teenage, adolescents, they will each have different challenges and may express, you know, their stress or anxiety in different ways, depending upon their age.
Speaking of the schools and children too, I think it's important to keep in mind that kind of economic ramifications and even the inequalities that may result out of this pandemic, in that, one, these schools are having to spend a ton of money either switching completely to tele and getting Chromebooks and everything for all the students, or they're having to make different arrangements in the classrooms so that the schools can be safe. And so I think there's a concern that schools may financially really suffer after the pandemic. And then another side of it is that we've seen in some wealthier communities, what parents are doing is pulling their kids out of those schools, putting them in these pods where they are like small groupings, and maybe they hire a teacher. But then ultimately what that is going to do is increase inequalities for low income and higher income families. It's going to possibly lower the taxes coming in if those families are not, sending kids to school. And so a lot of kind of broader societal concerns as well.
Thank you both so much. And Dr. Rexroad chatted in a few minutes ago saying that their local health department staff in the state who have not had a day off in months. And this could be an area where the universities help them out, and first by studying and then with intervention. And then she also said that our health department staff get cursed on a daily basis. That's wearing on them. So I just wanted to read that off. Thank you, Dr. Wexford, for sharing that. And there's
kind of interesting. I know at WVU, we had initiated, when COVID started, it was called a BEST program. Oh gosh, I'm not going to remember the acronym stood for, but basically it was a intervention. Basically it was therapy services that were confidential, that didn't go towards your EAP numbers, didn't go towards your insurance. It was like a drop-in clinic for people to be able to kind of talk about some of these issues that they're feeling. Maybe didn't get utilized as much as we might have thought. I think because the pandemic in West Virginia, it's worse now than it was maybe back in March. But it kind of makes you wonder if that would be something that could be really useful for public health, local health department staff to have some sort of, employee assistance program or drop-in clinic that they could get some therapy services for.
Absolutely, thank you. And there was another question asking, I think it was kind of geared towards the child and adolescent side of things as well. So this might be a question for both Dr. Lillard and Costello, but anyone feel free to chime in as well. But they were wondering how parents can protect their teens throughout the pandemic and suicide risks alongside that.
I'll let Dr. Costello handle that one.
Yeah, I think it's a great question. I think having an open dialogue and making sure that you check in with the teen is important. And obviously there's different strategies. Josh Shipp, I can share his link. He is a child who was in the foster care system, and he actually spoke at our national AAP conference a few years ago and just really talked about, the importance of kind of how you connect with the teen and having one caring adult in a child's life, and how that can really make an impact, and even give strategies on how you can bring up, and has data from before the pandemic about how teens would typically not, share if they had suicidal ideations. And I think, as Dr. Lillard has articulated, we expect that to go up in the times of the pandemic. And so I think, making sure that you have an open dialogue and maybe sharing with them that, it's okay to have feelings of uncertainty, and saying, for an extent, it's okay for a period of time. But then if it starts getting to the point where, you're thinking of harming yourself or killing yourself, or lasting for longer, then, it is okay and encouraged to reach out and to talk to someone. And I always recommend reaching out to your pediatrician, but then also, reaching out perhaps for psychology services, or to see a child psychiatrist as well. But I do think it's important to have that dialogue with teens and be reassuring, and then also modeling the behavior. So I think that a lot of parents are, as we've discussed, are struggling. And so teens and children feed off of that. And one of the cases that I had was very much, and when the child was kind of questions alone, said, like, I'm more worried that my parents are going to get this. She had some older parents, and I'm worried, I might give it to them, or, she was more worried about her parents because she expressed how nervous her parents were about contracting COVID. And so really the conversations that adults have around their children and teens, they hear and absorb a lot. And so making sure the parent themselves, whether it's the parent getting help themselves or acknowledging that they may have similar feelings, I think is also important when we're talking about helping our teens. Pediatricians, we always say, to take care of others, you have to first take care of yourself. And we know that parents would do anything for their kids and their teens. But, in this case, I would strongly encourage people to also look at the help that they may need to receive, because certainly their children and teens will feed off of that and model that behavior. So hopefully that answers some of the questions, but I'll find this link and share it in the chat too.
I was also thinking about helping teams to understand, like to sort disinformation, because I think there's a lot of disinformation out there about, how is the pandemic, how is the virus transmitted? How can we protect ourselves? And maybe finding a way to help them kind of understand the decisions that they're going to make as far as, social distancing and wearing masks and missing time with friends and all of that could be really beneficial and important in helping them make decisions to keep themselves safe.
Thank you.
Yeah, particularly the social media part of it. I think managing the media consumption is really important, and encouraging digital breaks can be really, really important during this time as well. I know that that's one way that people have somewhat stayed connected while we've had to be physically distant, but social media, there's a lot of things that can get misconstrued. Also, one thing is like video games, because a lot of video games now also include interaction, and there's a lot of bullying that happens, even though people aren't physically there. Some of the increased, anxiety or depression teens or even children may be having, may be coming from bullying. So, maybe people would think bullying is more so in person, but we see a significant amount of bullying on social media, and then also in these different video game platforms that now, allow you to play against or with friends. And so just really recommend having a good digital strategy or communication plan. Hopefully you already had one, but that recommending that to parents of having a digital media consumption plan, and making sure that that's being reviewed and adapted during the pandemic, depending upon what's going on with your teen or child.
Thank you. And there was another question, we might have time for one more question here, asking if there were any studies done on how different socioeconomic factors may increase or decrease the risk of suicide related to the pandemic.
That's a really good question. I don't think I have the answer, but that's something I could do some research and I can get shared out with everybody. I was thinking that I had seen it's not coming to me at the moment. Let me do some research before I give that answer, unless Dr. Costello thinks she has any thoughts on that one.
Nope, I would defer to you. So
I don't want to give misinformation, because on one hand, I think there's a lot of resiliency factors in different minority groups, but I also think they're being disproportionately affected by the pandemic. They're disproportionately affected by unemployment or working through the pandemic. And so that to me would suggest concerns about increasing rates, although we also know that statistically white males are the highest rate of suicide, completed suicides in the US too. So there is some protective factor with race and ethnicity. I think a lot of people think that has to do with social connection. And so then you've got the COVID pandemic where maybe they don't have that kind of family support and social connection. So let me do some research and see if we can find anything.
yeah, and the only other thing I would add, I think some of it is confounded because while we're dealing with the pandemic, we've also seen a significant amount of social injustices, and there's been much more discussion about structural racism. The AAP has a clear policy statement of the impact of racism on child health and defines it as a threat to child health. And so I think having that the social unrest paired with a pandemic, you kind of have two things going on. And so I definitely think it would be additive, but I think we need to look at that. And I know that there are groups doing that, but I think that is also an area, and the AAP guidance I shared speaks to that it's not only the pandemic, which we know is disproportionately impacting minority communities, but also the ongoing social unrest that we see And I think that, you know, this week there's been a lot on the media, and, you know, you kind of get those topics that get brought back up. And so for a lot of people, you know, even been sharing, for many people, you know, it is almost like a PTSD or a trauma, you know, reminding them of past things that they may have, you know, they've been working through. So I think being cognizant of that is also something. You know, there's also other things going on. We already had our slew of problems before the pandemic, and so there ends up being additional challenges as well.
Thank you both very much. Were there any other comments or questions you wanted to ask of the group? We have about 5 minutes left, but we do have a poll that we would like to launch at the very end, so we can leave some time for that as well. But we got a chat and asking if you could send the link for the recorded session. Absolutely. We also post them on our YouTube page, which in the recap email. All right. Well, thank you all so much for an awesome session. Thank you, Dr. Lillard, for that great didactic, super timely and relevant. And thank you, Dr. Costello, as well, for helping to answer all the questions and sending in all those resources as always. So I will send out a recap email with all of the information in there, so keep an eye out for that. Feel free to shoot me an email if there are any questions after the fact. I'll make sure they're addressed. So if you all could sort of hang on a few more minutes and fill out this poll, that would be wonderful. Anytime you're finished filling it out, just feel free to exit the meeting. Thank you.